Learning Plan 1. This is the basis of the entire class. We're going to talk about prioritizing, managing, and organizing every aspect of your profession. Will dictate those three concepts. So, this lecture is going to be a little new for me. I've never video recorded myself doing a lecture before, so bear with my fumbles and mistakes, okay? I'm human too. I am, of course. See, there's me. Welcome to the class. We're going to have a fun summer. Hopefully these video lectures will make it a little bit more entertaining. Hopefully even educational, but at the very minimum, entertaining. We're going to talk about these three concepts right off the bat because they are that important. And I'm trying to get used to which way I have to move to. So again, it's a learning curve here. Prioritize, manage, and organize. Probably the most important, probably the most difficult. You've made it this far in the nursing programs. And I know I'm talking to people from around the state. We have people from the west side of the state. We have people local. But you've made it this far. You know how to do your work. Now I want to help you become professionals. That's what this class is all about. I'm not going to teach you how to start an IV or how to calculate a drip rate. I assume you already know those. I am going to teach you how to become managers, leaders, because as an RN, you are in charge of your team. And if that doesn't scare you just a little bit, you don't realize the significance of this job. It's a big job. You could be in charge of LPNs, CNAs, health unit coordinators. You might be in charge of other RNs. Prioritize, manage, and organize. If you keep those in mind, you will succeed. So why do you have to manage? Well, how do you like your assignment load for clinicals? Are they busy? How do you get things done? How do you handle changing conditions with your patients? You prioritize who needs your help first. You stay organized so you're on top of everything, and you manage by delegation as needed, right? How do you like delegating, by the way? Is it fun, easy, simple, scary, uncomfortable? All of the above. Probably more toward the scary, uncomfortable than anything else because you may not be used to delegating. You will have to delegate as you enter this profession. You simply cannot do everything unless you are a primary care nurse responsible for only one patient. And we're going to talk about that kind of healthcare coming in later learning plans. Organization. I am certain that you have a tool that you've created to organize your assignment. And if I have 30 students in front of me, I will probably see 30 different methods for organization. I don't care how you organize, just get organized. So find a tool that works for you, modify it as you go along. As you move into this profession, you'll discover that you need different things. You'll need different information to stay on track. That's part of growth. Get organized. Get organized in your environment. Have your pockets loaded with the things you'll need. Pens, pen light, your stethoscope. It's amazing to see nurses walk around without a stethoscope. Now I know that in some situations infection control says not to bring a stethoscope in a room, but I really believe that you need to have your stethoscope with you at all times. Don't give it to doctors. It'll often walk off, especially if it's a nice stethoscope. Maybe have forceps, hemostats, clamps, bandage scissors. Have some alcohol wipes. If you're working in an ER, maybe have some simple bandages. Things that will make you more efficient because you won't have to go out and find things. When I worked in the ER, I would arrive on the job and I would immediately load up my pockets with IV start kits, IV catheters, some saline syringes, so I could walk into any room and start an IV right on the spot without having to find anything. I was ready. Frequently I'd go home and bring all this stuff with me, and then I'd have to bring it back. But that's just because that's the way I am. Managing your tasks. When you have a list of jobs that you need to do, some will be fun and easy, enjoyable, and some will be, well, for the lack of a better word, miserable. What should you do first? Tackle the tough stuff first. Whoa, hi. Tackle the tough stuff first. I was talking to the microphone first. When you get rid of that bad assignment first, everything else on the day is easier. And it also will frequently free up more time to focus on other assignments. So tackle the first and nastiest job first, and then do everything else. And don't procrastinate. If you have an assignment, be it for this class or any other class or on the job, if you're given an assignment and you don't want to tackle it right now, the assignment doesn't go away, does it? It just hangs out there in the future, making your life miserable. Get it done now. And then move on. Do not expect perfection in your work. Just don't. I don't expect my students to be perfect simply because I'm not perfect. I expect my students to strive to improve themselves every day. So when you're doing a paper for anybody, perfection is wonderful, but if you are working for perfect, you probably will obsess over that paper to the last possible second, submit it, and then find out it still wasn't perfect. Do good work, submit it, move on. That's the key to success in life everywhere. Manage your paperwork, manage your assignments. And in managing this, you're also going to prioritize. See right over here, prioritize. And how are we going to prioritize? There's basically 3 levels of priorities. And I'm not going to need to write this down. We're just going to talk about it. There are some things that you need to get done right away. ASAP, do it now. Some things that are necessary but don't need to be done immediately. And things that can be done when you get around to them. What are some examples on the job? What would you need to do now as an RN? Well, obviously, if your patient's coding, you're going to need to respond. But let's hope we don't let your patients get to that situation. Some things that you need to do now. You may need to call the doctor now. If you get some critical lab results, say a potassium of 2.9, that's not a I'll get to it later, or even I'll get to it in a little while. That's I'm calling the doctor now. Right? What are things that are important but can be done in a little while? Well, if your patient needs to ambulate 3 times a day, do they need to be ambulated immediately at the start of your shift? No. That needs to get done. And it probably needs to get done sooner rather than later, because as you all know, a nurse's shift never goes smoothly, does they? And he can't talk. Good thing I'm a nurse, not a language arts instructor. What can be put off till whenever? To a large degree, some of the routine daily charting. Now, I'm not talking important charting for the patient, but some of the more routine administrative charting tasks. Those can be kind of fit in as you see fit. Now, managing, can you see that a little better? Yes, you can. Manage your interruptions. When you're studying for an assignment, when you're working on my paper, and you will be working on my paper, will Will you have the best results if you check your Facebook status every 5 minutes and tweet every 10 minutes about it? Or will you have better results if you just get going, turn off your computer, turn off your phone, and focus for a half hour, 45 minutes, and then check your Facebook status and tweet? Yes. If you can work on something unbroken, you will have more success producing better results than if you do a little bit here, a little bit there, a little bit here, because you're always restarting. I compare this to CPR, chest compressions. Chest compressions. How many of you had to do chest compressions on a real person? I have. It's not fun. But you may get to do that in life too. When you're doing chest compressions, what's the purpose of chest compressions? It's the purpose is to get the heart pumping blood. And it takes about 30 seconds of compressions before blood actually starts moving through the vasculature. If after 20 seconds you stop your compressions to check something, it takes another 30 seconds before that blood gets moving. And if you stop after 20 seconds, that blood's never going to move. So do compressions for a full 2 minutes. Then stop if you need to do something. And then starting up again for 2 minutes. Unbroken, uninterrupted work produces better results faster and easier than little tidbits here and there. When you're managing people, you'll need to communicate. And communicate assertively. Assertively. We'll be talking about assertive communication in a later lesson plan, but let's just talk about that real briefly right now. What is the difference between assertive and aggressive? Aggressive is, get over here now. How do you like that? Did that make you feel good? I don't even like saying it. But how about this? I need your help now. Same end result. But with get over here now, you get over here now, I'm making a you statement. But with an assertive statement, I'm saying, I need your help now. It's an I statement. So almost always, if you start with an I phrase, it's going to be assertive. If you start with a you phrase, it's going to be aggressive. Probably already knew that. Here's something you're probably going to be surprised to know. A lot of the stuff you'll learn in this class, you already know. You really do. You guys are senior level students or will be very soon. You know this stuff. I'm merely making sure that we polish it off and get it ready to be used, okay? Now, problem situations. How are you going to handle problem situations? Your CNAs don't show up on time. Or how about this? You're given an assignment that is far too hard for you. It could be that as a new graduate, maybe you are placed in charge of the entire facility as a new grad. It could be that you were given an assignment that was simply too hard. You're working in ICU and suddenly they gave you 3 ventilator-assisted patients. That's unsafe. How are you going to handle that? Have you read the Board of Nursing's position statements on workload? If not, in the learning plan you'll see the exact pathway. Board of Nursing does not make it easy to get there, but I gave you the exact path to follow, so that will help you. SBAR communication, and you've gone over that and over that and over that. Nothing really new there. SBAR, we'll be talking about that occasionally, but honestly, do we need to spend a lot of time talking about that? If we do, if somebody's not sure what I mean by SBAR communication, please let me know. And we will talk about that in greater detail. Cute little side story. By the way, in case you didn't know, I like telling stories. I tell a lot of stories about my personal experiences and sometimes my students' experiences, but I, of course, will never identify the student. Mostly it's my experiences. Excuse me. I teach clinicals at a hospital in Manitowoc, Holy Family Hospital, and there is a doctor, a surgeon out there, and the surgeon's name is Sabar. Not Esbar, not Dr. Esbar, Dr. Sabar. So when you're talking to Dr. Sabar, you always have to use the S-bar communication. It causes a little bit of confusion. It's fine. Learning Plan 1 is a very small learning plan. Have you noticed? That's okay, right? I try to make these learning plans focused. I want to get to the information that is actually critical for you to learn. In everything in life, there's nice to know and there's need to know. I'm trying to focus on need to know. With that being said, if I talk about something, it's a need to know, unless it's my stories, and then those are just used to illustrate need to know concepts.